Yes, my name is Kenneth Liegner. I'm a physician, internist with a background in training in critical care medicine, and I've been involved in Lyme disease diagnosis and treatment for around a quarter of a century. ILADS has been an organization that has helped to disseminate proper information about Lyme, and has held educational seminars, and also produced their own guidelines for Lyme disease diagnosis and treatment, and I think those guidelines are being updated, and hopefully there's going to be a new updated set of guidelines that will be available that will also be very helpful. It's an opportunity for physicians who are endeavoring in this field to share their experience and learn from one another. Yeah, I got into Lyme through pure chance. I just opened a practice in Armonk. I knew almost nothing about Lyme disease, but it turns out that Armonk was the venue for a burgeoning epidemic of Lyme disease, and as a practitioner who just opened his office in the early or mid-'80s, you just couldn't help but seeing patients with Lyme disease, and they were interesting, they were challenging, they didn't follow the rules according to the way they didn't follow the book in terms of how they behaved, and one thing led to another, and I just started seeing more and more such patients. Around 1988, the local library was doing a lecture series, and they asked me if I wanted to, present a talk on a particular subject. So I was at that point seeing a fair number of people with Lyme, and decided to review most of the then available world literature, which in 1988 wasn't that much. So I could go to the medical library at my hospital and in about 3 months review, not all of it, but a good deal of it. And so I gave a talk in the basement of this little local library. At the time, Lyme was getting a lot of attention. A lot of people were getting sick, and a huge number of people showed up, like 300 people in the basement of this library. And so I gave a talk, and all of a sudden I was instant expert in Lyme disease. Not that I was, it's just that I knew more than anybody else because I had reviewed the literature. And then I just started seeing more and more patients, and after a number of years I kind of focused almost completely on tick-borne diseases, and I stopped doing general internal medicine. Well, the illness itself is quite challenging. Lyme, if that was the only thing you had to deal with, it's quite a complex infection, presents in a myriad of ways. And there's classic presentations, but there are also unusual presentations, sometimes one-of-a-kind presentations, and also what Lyme is or does hasn't been fully defined yet. So sometimes you see cases that have never been even reported in the world literature before. So you have to be alert that this is a disease that its full range of manifestations has not yet been reported. And it can present in so many different ways, and often involve multiple systems. And so Lyme itself, if that was all we had to deal with, itself is it's a new infection. It's only been around, known to medical science as Lyme, as a borrelial infection for around 40 years or so. And I'm fond of pointing out that it took medical science at least 500 years to get a good handle on syphilis, and we're only 40 years into Lyme, so there's still a lot to learn. Well, I think it's gratifying to see people who are compromised, debilitated, be able to slowly recover and go on to live full and satisfying lives. Sometimes we're fortunate people are able to get pretty close to 100%, stop treatment and remain well off treatment, but that's not always the scenario. So people recover to varying degrees. Some patients, if they go off treatment, begin to get sick again. And of course there's some people who have such severe damage that although we may be able to help, sometimes there's a degree of irreversible injury that we're not able to to reverse. But my experience is that most people respond appropriately or favorably to appropriate treatment. The trick is to find out what is the appropriate treatment for a given person, which can be quite variable. Well, sticking with Lyme disease alone, there's a wide variety of strains. The limitations of our testing, which leaves a great deal to be desired. The fact that we do not really have a widely available test that's highly sensitive, quantitative, that can let you know whether the person still has the infection or not, and desirably one that's not just qualitative but quantitative, as we have with other infections like with HIV. We can measure viral load. We're not there with Lyme, and it's been frustrating to know that we could have had better tests for a long time, and it seems like those tests have been kind of quashed. So it will be very helpful when we have better methods of testing that can also pick up the different strains that are out there, besides the one that's used as a reference strain. Well, it's an opportunity to take people who are in the field and get them to understand the complexities of Lyme disease, spend time actually with the patients, and it takes a while to get a handle on Lyme, and it is a very complex illness. It evolves over time, and it's very important for each patient to tell their story. And I think it's been useful to, whether it's nurse practitioners or young physicians, to learn about the illness from physicians who have been dealing with it for many years. It can be helpful. And we put together what I call sort of a course curriculum, which is key references from the medical and scientific literature. I've sort of put together for the benefit of the people who train here. It's helpful to have people come through the program and then begin caring for patients on their own. There's, as you know, there's a shortage of physicians who have spent time really studying the illness, and so anything that can be done to educate others is obviously going to be helpful. I would say the determination of the patients to get well is inspiring, and many of them are very, very dedicated to doing whatever they need to do to, first of all, determine what their diagnosis is, and then to explore the different ways in which they can get well. We as physicians have certain approaches that we use, but also we're constantly being pushed, and the envelope is constantly being expanded, and sometimes that's patient-driven. This is an evolving area of knowledge, and no one can claim to have all of the answers. So until we have some silver bullet for Lyme, which I don't think we have, I think we have to keep an open mind to different ways in which people can be helped. Well, I think understanding Lyme is, I don't know if you know anything about locksmithing, but you need to have the right blank to make a key, and often it can help be a unifying explanation for people who come in with what seem to be disparate and unrelated symptoms. Not always, but if you're on the right track, it can often be that Lyme is underlying this wide range of symptoms that people are experiencing, and if it's the correct diagnosis, when one applies treatment, many of these symptoms begin to dissipate and sometimes completely resolve. So and it takes a while to get a handle on Lyme. It's a complex illness, and it really takes time studying the patients and over time, and observing them in relation to intervention of different kinds of treatment. Also, another kind of intervention is observation, stopping treatment and seeing what happens. So it takes quite a while to get a handle on it. Well, an important part of physicians' obligations and duty is to teach others. I think that's part of I believe it's part of the Hippocratic Oath, is to convey learning to other physicians, and so that's part of what this training program is to teach what you know to others. Well, a lot of the curricula that's being promoted is incorrect. A lot of the mainstream notions are incorrect, and it's very hard to counter that when it's coming through mainstream sources and being reinforced by academia and CDC. So there needs to be a mechanism whereby people can have a different understanding of the nature of not only Lyme but also the tick-borne co-infections, which that's the other thing that's obviously complicating the issue. If Lyme was the only problem, it would still be a huge problem and a difficult one to overcome. Then you throw in these other tick-borne diseases, it can be quite a complex issue. For more information, go to ilads.org.